What is persistent vegetative state? A vegetative state, or post-coma unresponsiveness, is a disorder of consciousness in which patients with severe brain damage are in a state of partial arousal rather than true awareness. Consciousness is clinically characterized by wakefulness with awareness. Coma is an unconscious state in which patients are unawake, unarousable, and unaware. Coma typically progresses toward one of three neurologic outcomes. Recovery consciousness is restored, but patients typically have residual cognitive, motor, and/or sensory deficits requiring rehabilitation. Brain death, cerebral, and brainstem function cease. Patients have no cranial nerve reflexes and are apneic, no spontaneous breathing, requiring continuous mechanical ventilation. Persistent vegetative state, a chronic state of wakefulness without awareness. Due to the possibility of interim recovery, PVS can be diagnosed only after sufficient time has elapsed, since brain injury more than 3 months anoxic, more than 12 months traumatic, indicating minimal probability of recovery. Patients with persistent vegetative state are awake, evidenced by spontaneous eye-opening and normal sleep-wake cycles. However, they are unaware, as indicated by non-responsiveness to external stimuli, absence of language comprehension or expression, and lack of purposeful visual tracking. Brainstem reflexes, for example, cough, gag, pupillary constriction, are usually intact. Because voluntary sphincter control is lost in patients with persistent vegetative state, patients have urinary and fecal incontinence. Similarly, control of swallowing a complex voluntary process is lost, so patients with persistent vegetative state require enteral, for example, gastrostomy tube feedings. A 24-year-old previously healthy man is brought to the emergency department after a motorcycle collision. The patient was intubated in the field. On arrival, Glasgow Coma Scale is 3. CT scan of the head shows left temporoparietal skull fractures, a large subdural hematoma, and diffuse cerebral edema. The patient undergoes hematoma evacuation and decompressive craniotomy. He is admitted in the neurocritical care unit and supportive measures are provided. His clinical status gradually improves, and the patient is extubated on day 9. Over the next 15 months, the patient opens his eyes spontaneously, gazing randomly around the room, but does not visually track moving objects. Bilateral pupils are equally responsive to light. He does not vocalize or follow instructions. The patient moves all 4 extremities, but the movements are not purposeful, and there is no withdrawal to painful stimuli. The patient tolerates feeding via a percutaneous gastrostomy tube, but has urinary and fecal incontinence. This patient suffered a catastrophic traumatic brain injury and was comatose initially. The diagnosis is persistent vegetative state. Cataplexy is an abrupt, massive inhibition of muscle tone typically triggered by strong emotions, laughter, fright in patients with narcolepsy. Patients suddenly go limp and collapse, but they usually recover after a few seconds. Locked-in syndrome can occur due to osmotic demyelination, for example, excessively rapid hyponatremia correction, or infarction, for example, basilar artery stroke of pontine corticospinal neurons. As opposed to being unaware and mobile like this patient, locked-in patients are aware but completely paralyzed except for blinking and vertical eye movement. Selective mutism is a form of social anxiety disorder in which patients do not verbalize despite negative interpersonal consequences. Despite not speaking, these patients' level of consciousness is intact. Persistent vegetative state, a chronic state of wakefulness without awareness, is a common post-coma outcome following severe brain injury. Patients with PVS have sufficient brainstem function to maintain vital processes such as spontaneous respiration, but require continuous medical care due to absence of purposeful movement and communication.